Bismillahirrahmanirrahim. Assalamu alaikum. Today my topic is chambers of heart. The heart is a hollow organ divided into four chambers: right atrium, right ventricle, left atrium, left ventricle. Right atrium. The right atrium is a broad triangular structure. The superior vena cava opens into doma of right atrium and the inferior vena cava into its lower posterior part. The right atrium is a thin walled chamber that receives the blood returning from the body tissues. This blood, which is low in oxygen, is carried in the veins, the blood vessels leading to the heart from the body tissues. The right ventricle extends from the right and atrioventricular tricuspid orifice nearly to the cardiac apex. It is then reaching the pulmonary orifice and supporting the cusps of the pulmonary valve. The ventricle possesses an inlet component which supports and surrounds the tricuspid valve. The right ventricle pumps the venous blood received from the right atrium and sends it to the lungs. Left atrium, although smaller in volume than the right, the left atrium has thicker walls, 3 mm on average. Its cavity and walls are formed largely by the proximal parts of the pulmonary veins. The left atrium receives blood high in oxygen content as it returns from the lungs. The left ventricles. The left ventricle is constructed in accordance with its role as a powerful pump. Its cavity is oval or nearly circular with walls about 3 times thicker, 8 to 12 mm, than those of the right ventricle. The left ventricle, which has the thickest wall of all, pumps oxygenated blood to all parts of the body. This blood goes through the arteries, the vessels that take blood from the heart to the tissue, valves of heart. The ventricles are the pumping chambers. The valves, which are all one way, are located at the entrance and the exit of each ventricle. The entrance valves are the atrioventricular valves, while the exit valves are the semilunar valves. Semilunar means resembling a half moon. The two atrioventricular valves, which are between the atria and the ventricles. Mitral valve, tricuspid valve, the two similar valves which are in the arteries leaving the heart. Aorta valve, pulmonary valve. Mitral valve, the left atrioventricular valve is the bicuspid valve, but it is usually referred to as the mitral valve. It has two rather heavy cusps that permit blood to flow freely from the left atrium into the left ventricle. Both the tricuspid and mitral valves are attached by means of thin fibrous threads to the wall of the ventricles. The tricuspid valve is the three-flapped valve on the right side of the heart between the right atrium and the right ventricle, which stops the backflow of blood between the two. It has three cusps. Tricuspid valve, the right atrioventricular valve also is known as the tricuspid valve, since it has three cusps or flaps that open and closes. When this valve is open, blood flows freely from the right atrium into the right ventricle. However, when the right ventricle begins to contract, the valve closes so that blood cannot return to the right atrium. Aortic semilunar valve. The aortic semilunar valve is located between the left ventricle and the aorta. Following contraction of left ventricle, the aortic valve closes to prevent the flow of blood back from the aorta to the ventricle.